Today is a very important renal lecture. The last lecture we talk about how the kidney can regulate acid-base balance, how can the lung regulate the volatile acids. Today we are going to discuss acid-base disturbances. I mean by disturbance an error. We are talking today about an error. Error either in acid or in base. So if you have an error in acid, it means either increase or decrease, and the same as in base. So today we are going to talk about acidosis, and we agree together. Osis means increase, alkalosis, and here again osis means increase. So what about types of acidosis and alkalosis? All of us should imagine that we have either error in respiratory system, it cannot regulate the volatile acids, or it wash out the volatile acid more than normal. The kidney has also two errors, either decrease reabsorption of sodium bicarb or increase reabsorption above normal. So we have four errors, two in the lung and two in the kidney. But before discussing the errors, I want you to imagine something so important. If the error in the lung itself will not correct what happened. The correction will be by the other side, the kidney. And if the error in the kidney, the correction will not be by kidney itself, it will be by respiratory system. So to sum up what I am saying, the correction will be by the other side. No one have the error will correct itself automatic. This will not happen. Suppose you have an error in respiratory system, kidney should compensate. If the kidney compensate this error, and I am going to discuss it in this video, so you have normal acid-base balance. You will return back to normal. The same thing, if the renal has an error, the compensation will be by respiratory system. Before discussing the errors, I want you to remember Henderson-Hasselbalch equation. Henderson-Hasselbalch equation stated that pH equal pK plus log salt over acid. In the previous video, I told you that the numerator is bicarbonate, HCO3. Don't say sodium bicarbonate because it is understood. HCO3 means NaHCO3 over the denominator is CO2 pressure. I told you before that carbonic acid rapidly dissociated, so we will symbolize it as PCO2 because when CO2 pressure increases, this means that carbonic acid will increase because CO2 is more soluble in plasma. So to discuss the errors, we should know something important. If the error in respiratory system, this means that CO2 pressure either decrease or increase. So if CO2 pressure increases above normal arterial value, and I want to stress on something important. CO2 pressure is measured in arterial and not in venous blood. Doctor, why? Because arterial blood is constant. Venous CO2 is variable according to metabolic activity. Suppose the tissue is active now, so CO2 pressure as waste product is going to increase and vice versa. So CO2 is taken from arterial blood. Here you should know the normal CO2 pressure in arterial blood equal 40 millimeter mercury. All of us know that CO2 pressure in venous blood is higher, equal 46 millimeter mercury. But now we focus on CO2 pressure in arterial blood. So suppose I put the syringe in the artery, here in the radial artery, perpendicular, and I withdraw the blood, I will make arterial blood gases examination. If CO2 pressure, suppose, equal 48 millimeter mercury, this is above normal arterial value, which equals 40 millimeter mercury. So I accuse who? Respiratory system or kidney? Respiratory system, because it doesn't wash out excess carbon dioxide. So if CO2 pressure increases in the denominator as an error, this is acidosis. Doctor, why? Because CO2 is soluble in water, so it will form carbonic acid. And all of us know that any acid is symbolized by hydrogen ion. And when we were in primary school or secondary school, we know that acid which dissociate in water. It's very important to understand this, producing hydrogen, positive hydrogen ion. So acidosis. Which type? Respiratory acidosis. Your question now, why the lung cannot wash out excess CO2? Where is the defect in the lung? To be more precise in your answer, you should not start by respiratory system. You should start by respiratory center in the medulla. Suppose my respiratory system is normal, but the order coming to it from medulla is not working. Suppose you have a problem in the respiratory center in the medulla, and this occurs respiratory center depression. Respiratory center is not working by morphine poisoning. Yes. In addiction, it makes problem to wash out excess carbon dioxide. So acidosis is the result. This is number one. Number two will be the respiratory diseases, lung diseases. Suppose I have pneumothorax. There is air inside the pleurum. There is lung collapse. Suppose I have pulmonary edema. So here the alveoli is filled with water. You have little space remaining for air. So lung collapse occur. How do you have lung collapse and you want the lung to wash out excess CO2? This will not happen. Suppose you have another problem which is called effusion or edema. Any problem which can hinder the lung to do expiration. This is very important. Suppose the lung is normal, so we will shift to the third cause, respiratory muscle disease, as poliomyelitis. These are examples of the problems facing the lung. One student can tell me, suppose you have a problem between alveoli and the pulmonary capillaries. Yes, you have ventilation, perfusion mismatching. This is a problem which I discussed before in respiratory lectures. So, to sum up what you are saying, you have the respiratory defects either in respiratory center, in the lung, or respiratory muscle. So what will happen? CO2 pressure increases ultimately in the denominator. So if you increase the denominator, what about the ratio? Is going to decrease. pH decreases. And all of us know that hydrogen ion is inversely proportional to pH. If pH decreases, this means that hydrogen ion increases, so acidosis occurs. And it is called respiratory acidosis. The question now, how can the ratio be compensated? When we were in primary school, they told us in mathematics a very important knowledge. If the denominator increases, you should increase the numerator by the same value to make the ratio constant. So bicarbonate should increase to compensate the error. The kidney should increase bicarb reabsorption by 3 different mechanisms which I explained in the previous video here in the channel. If you didn't see the video, please, I want you to see it. Kidney can regulate or increase sodium bicarb reabsorption by reabsorption of already filtered sodium bicarb. Second, by disodium hydrogen phosphate. Do you remember? Titratable acid is going to be formed, which is sodium hydrogen phosphate. Third mechanism is ammonia, and we discuss it by diffusion trapping mechanisms in distal tubule. This is the role. I want to give you some numerical values, and please, I want all of you who see the video now to bring a paper and write with me. Suppose in the normal condition, the ratio will be what, doctor? Bicarb as numerator over CO2 pressure as denominator will equal 20 to 1. 20 over 1. So, suppose the 1 in the denominator increase. Suppose it will be 2. So, my question now, you want bicarb to be what? So, if it divided over 2 equal 20, you will say simply bicarb equal 40. So what happens? You increase CO2 pressure as the denominator and you increase the bicarb as a compensation in the numerator. This is important. You should know by heart what is the normal value or concentration of sodium bicarb. Equal 22 to 24 milli equivalent per liter. So 24 will increase more to compensate for the respiratory error. So here we discussing how the kidney can regulate this. One student will ask me, doctor, what oblige the kidney to do this? We understand what you are saying. The ratio should increase the bicarb to compensate for increased CO2 pressure. But what this can happen? How the mechanism is done? If the hydrogen ion increases, this is an acid. So we need reabsorption of sodium bicarb to neutralize the acid. I want to convert the acid from strong one into a weak one. So I need an alkali reserve. And this is the responsibility of the kidney. It should reabsorb sodium bicarb. Sodium bicarb is reabsorbed 100%. 100%. The same as glucose, as amino acid. 100%. You should know this well. So, this is a compensation. What about the second condition? The lung is overacting. You are hyperventilating. So what will happen? Look to me now. I am washing excess CO2 more than normal. So CO2 concentration in plasma is going to be lower than 40 millimeter mercury. So alkalosis occurs. If the acid decreases, alkali level will be dominant. So it will appear as relative alkalosis. And again, the error in what? Respiratory system or kidney? Yes, respiratory system. So it will be called respiratory alkalosis. And What are the causes of this? Doctor, you said hyperventilation. Yes, hyperventilation appears in high altitude. Did you remember when I discussed blood lectures before? I told you that on high altitude, oxygen pressure is low. You should hyperventilate to take more oxygen and wash out CO2. And this can also occur in sea level. I am not living in Mexico City or on Alps mountain in Italy. I am living in Egypt. I am hyperventilating on not on high altitude. What is the reason? Maybe I am hysterical. It is a psychological problem, or either fever or meningitis, inflammation of the meninges. Doctor, return back to the ratio. What will happen? You have numerator and denominator. CO2 pressure in the denominator is decreased, is low. So, can the kidney reabsorb more sodium bicarb? No. The kidney will reabsorb less sodium bicarbonate to correct the error. And it seems to be logic. I don't have excess acid in plasma. So what is the benefit to reabsorb excess alkali reserve? To neutralize what? It seems to be ridiculous. So God makes wisdom in this. It makes everything in a very proper way. So bicarb decreases to compensate the error of decreasing CO2 pressure. Can I give you numerical value as before? Yes. Suppose CO2 pressure equal half. The normal is 1. Here is half. What about bicarb? Equal what? To make the ratio equal 20. Bicarb will be 10. 10 divide half equal 20. So look, what happens? Bicarb concentration decreases from 20 to 10 to compensate the error in the respiratory system. So the condition will be called compensated respiratory alkalosis. Here I discuss two errors: respiratory acidosis and respiratory alkalosis. Suppose the bicarb in both conditions didn't match with CO2 pressure. It didn't increase in the case of respiratory acidosis, and it didn't decrease in the case of respiratory alkalosis. So this is called uncompensated condition. You cannot correct the error. The remaining two errors will be in the kidney. The kidney decreases bicarb reabsorption. Doctor, this means what? You have an error. My question now to all medical students watching the video: is the error in the kidney or respiratory system? You will say, that's sure in the kidney. So I should name the abnormality renal acidosis or renal alkalosis. But all textbook didn't say this. They say metabolic acidosis. So our question to you now, doctor, why did you say metabolic? Because the main error in metabolism. I will explain more. Suppose now I am a diabetic patient. I suffer from low insulin level. If the insulin concentration is low, glucose will not be transported into the tissues. You will have hyperglycemia. And so, what the tissues can consume or burn to have energy, it will consume fat to have fatty acids. And if you return back to biochemical lectures, fatty acid will be oxidized into acetyl-CoA, and at the end by beta oxidation it will form acetoacetic acid and beta hydroxybutyric acid. And these acids are in a higher concentration. Kidney at first reabsorb sodium bicarb, but the buffer here is so low. Your army has small amount in defense of the enemy. Who is the enemy? Acetoacetic beta hydroxybutyric acid. So it appears to be that the buffer is decreased. And it will be metabolic error. Yes, you have an error in carbohydrate metabolism. This is the most important cause. So we call the abnormality after the most important cause, metabolic acidosis. You have many different problems. Either lactic acid increases. Lactic acid, if it increases and you cannot neutralize it, it will be lactic acidosis. All of us know that lactic acid is inactivated in the liver. It changes into another compound in the liver. So if you have liver disease, you cannot convert the lactic acid into another compound. So you have acidosis related to metabolic error in the liver. Or maybe you suffer from shock. What do you mean by shock? Low blood pressure, which is reflected on perfusion of tissues. It will be low. If the tissues receive less oxygenated blood, so glucose is going to change anaerobically into lactic acid. So all of these are problems. Number 1, diabetic. 2, lactic acidosis. 3, shock. What about the defect in the kidney? Renal error is number 4. So don't be astonished that we call the error metabolic acidosis. Return back to the ratio. If bicarb concentration decreases in the numerator, what about CO2 pressure? Is going to decrease also to match the error. Every time you should match the error. If the error decreases, compensation other side should decrease at the same value. If the error increases, compensation should increase at the same value. This is matching. It's very important. Return back to numerical value. Suppose bicarb concentration will be 10. It decreases as an error. What about CO2 pressure? 10 divided what equal 20? Then 10 divided half equal 20. CO2 will decrease from 1 to half to compensate the error. And this is compensated metabolic acidosis. If this doesn't occur, it will be uncompensated metabolic acidosis. We have different causes of this, but I want to focus on the important. The final type or final error is metabolic alkalosis, which occurs by persistent vomiting. And here you will have a question. Doctor, vomiting of what? Of gastric content. All of us know that stomach secretes HCl. If you lose HCl, so alkalosis occurs. Number 2 is diuretics, or excess intake of alkalis, or excess fruit or vegetables. Suppose I have peptic ulcer. I have high HCl secretion. I am drinking now sodium bicarb, which is milky in nature, to neutralize the acid. If I exceed the intake of this buffer, alkalosis will occur. What about endocrinal conditions? All of us know Cushing syndrome. Cushing means increase cortisol. Cortisol in physiological conditions has mild aldosterone-like action. But in high dose, what will happen? Aldosterone will increase. Aldosterone increases sodium reabsorption and cause potassium or hydrogen secretion. So again, if you secrete the hydrogen, you get rid of acid in urine, so alkalosis will occur. So I want you every time in metabolic error to relate it to endocrinal disturbances. Return back to the ratio and our numerical value. Suppose the bicarb equal 30. It will increase in the numerator. What about the CO2 pressure? Equal what to make the ratio equal 20? Equal 1.5. This is very important. You should understand it well. Every time the compensation should match the error. In the final condition, in this video, I wanted to focus on a very important term called anion gap. What do you mean by anion? I mean negative ion attracted to positive pole of the battery. Gap means the difference. So difference will occur because of negative ions. Doctor, we didn't understand what you are saying now. I will make it simply for you. In all times, they imagine that if we add sodium plus potassium, and both of them are positive ions in concentration in plasma, it will equal to the sum of negative ion concentration in plasma. Chloride Cl negative, bicarb HCO3 negative. But it isn't correct. Sodium plus potassium concentration is more than chloride and bicarb concentration together by about 12 to 16 as difference. 12 to 16 milli equivalent per liter. They try to discover the difference comes from where. At the end, they found out that the difference is related to negative ions called anions, which is unmeasured. Like what? Lactic acid, sulfuric acid, phosphoric acid, acetoacetic acid, beta hydroxybutyric acid. All of these are fixed acids which is unmeasured. Doctor, can you give an example? Yes. Liver disease, lactic acid increases. Shock, lactic acid increases. And in diabetes mellitus, acetoacetic acid and beta hydroxybutyric acid increases. So here you have high anion gap. The unmeasured anions are going to increase in concentration. So can the anion gap be normal and I have an error? Yes. Suppose bicarb concentration, which is negative ion, decreases 5 millimole, and at the same time chloride increases 5 millimole, and both of them are added together. So if you have two negative ions, one decreases 5 millimole and the other negative ion increases by 5 millimole, so the same. So no difference will occur. Suppose I can add together two negative ions. One decreases 5, one increases 5. What will happen? They will cancel each other in the difference. So we'll have normal anion gap. So bicarb decreases. Chloride as other negative ion will compensate and will increase. Look what I am doing now in the video. So this is called what? Hypercholoremic. You increase chloride concentration. Hypercholoremic metabolic acidosis. Doctor, why? Because bicarb concentration decreases in metabolic acidosis. So you will have normal anion gap. But you should know well, bicarb concentration equal what? 22 to 24. Chloride concentration equal what? 110. 110. Sodium equal what? 135 to 145, average 140 milli equivalent per liter. Potassium concentration 3.5 to 5 milli equivalent per liter, average 4 milli equivalent per liter. These are written in data in USMLE question. You are not obliged to study by heart the normal level equal what? You will have the values in your case, because this video today is brought as cases on acid-base disturbance. You may have a mixed disorder, but this is not for undergraduate students. So we focus on 4 errors: respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. I discuss with you each error, its causes, and the error in denominator or numerator, how compensation will occur, and why we call metabolic error not renal error. Finally, anion gap, its definition, its normal values, what are the unmeasured anions which make the difference. I give you examples of high anion gap and the normal anion gap as hypercholoremic, metabolic acidosis. I should every time focus on bicarb decreases as a negative ion and the chloride as the other negative ion will compensate to make a homeostatic balance. At the end of the video, I hope all of you a good luck and best wishes for me and for all of you. You have Dr. Muhammad Faiz, lecturer physiology in Shams University, Egypt. If you didn't subscribe in the channel, please, you can subscribe to have more and more videos. Thank you.